Good morning, good afternoon, good evening, ladies and gentlemen of Town Union. My name is James Inehuefo. I'm from Enugu, and why I'm here is to talk about a disease which is uh, which is in line with what our ITU Healthcare Committee is planning, which is about health literacy program. So what that means is it's very nice for you to know if you have any disease or if you're suffering from any disease to have the knowledge, a better knowledge of what you're suffering from. But before I move on, let me first of all thank the President General of ITU, Dr. Magnus Chukwekezie, and the Chairman ITU Health Committee, Dr. Henry Ajala, and also the Education Committee for giving me a room at least this week to explain more and shed more light on these particular diseases my people always suffer, and general, even globally, it's a big problem. So before I move on, let me also do a disclaimer that this is not a full knowledge or a full topic or a full description of what I'm trying to talk about, which is cardiovascular disorder or cardiovascular disease. Please, this is a disclaimer. And this is not a consultation forum or a consultation topic. If you know you're suffering from these particular diseases or you have any of them, please make sure you consult your doctor or your pharmacist for them to answer your question. I'm gonna say everything, I'm gonna be super simple because of different kinds of people we have in this forum. If you're a professional, please pardon me. I'm not gonna use medical terms, pharmacological terms, prognosis, or maybe epidemiology, or maybe the prevalence. I can use prevalence a little bit as a picture, or maybe the bioanalysis statistics. I am not gonna use them here. This forum is for lay people, and for to carry everybody along, I have to be super simple on this topic, and I will make it snappy in order not to burn your data. Thank you very much. So let's start with the topic I'm gonna start with today is cardiovascular disorder or diseases. Now, when we talk about cardiovascular disorder or diseases, in short form, I'm gonna be using this abbreviation that way I can move fast. CVD or CVDs, cardiovascular diseases. Um, I want to give you a picture of what I'm trying to talk about. That way, you can have a broad picture of what is happening in your body. And I want you to understand that cardiovascular system is like the main engine in your body. Once they break down, you are gone. And that's why we have a lot of problems, people collapsing, people falling, people having difficulty in breathing. Unexpectedly, people will just give up like that. Before you get to someone will fall or collapse. Before you get to the hospital, the person is gone. Now, cardiovascular system is a very big system. Is a very advanced, or let me say, big system in our body, and that's why it's the main engine, and we have to take care of it. Now, let me show you all these diagrams for you to understand what I'm talking about. This is how your heart looks like. And when you cut your heart into two, this is the inside of your heart. This is the image of the inside of your heart and how it looks like. Don't bother about it. This is just a pictogram, just a picture of how your heart looks like. Now, this is a pipe. I'm going to tell you what it looks like. It looks like a vessel in your body. I will explain that. Now, this one is also a busted pipe, but this one is serious and more dangerous and more serious. You can see the water gushing out of the pipe, broken pipe. It happens in your body. Something like this takes place in your body. This one is also looks like one pipe is bad and the other two are good. The two pipes by the sides, those ones are good. Those ones, the fluid, the water can pass through them freely. But the one in the middle has a very big problem. We'll come to that. I know why I'm showing you all these pictures, so that when I'll be touching those other topics one by one, you will recall about all these pictures. Now, I'm talking about cardiovascular diseases or CVDs, there are certain diseases that are involved in it. It's a complex system. Let me explain. In cardiovascular disorders, CVDs, we have heart diseases, we have stroke, we have cardiac arrhythmia, which is irregular beating of your heart. We have hypertension is not included, but it kind of like it's contributing to heart disease. Then we have cardiac heart failure. Then we have cardiac valvular system or disorder. All these things are just a compound of what is happening to your heart and the vessels. We also have atherosclerosis. We will still come to that. This is just today is just an introductory segment of what we'll do in future, of what we do at least the rest of this week. I thank the education committee for giving me that opportunity. Now, I want to tell you a fact. Any figure I'm giving you here is a research that has been done already globally. Now, this fact I'm giving you has been done by WHO. Could you imagine that 17.9 million people died of CVDs, especially of heart attack and stroke? 17.9 million. And this was carried out on, this research was carried out on 2019. And 32% of these people died of CVDs are from or were from low income and middle income countries. You ask yourself, who are the middle income and who are the low income countries? Especially Africa is almost the majority, which Nigeria belongs to. So Nigeria is among them. Imagine, and Nigeria is the most populous black nation. And mind you that this particular disease I'm talking about, a research has been carried out, and black people are the most people, exposed people, predisposed people that suffer from this particular disease. Africans and men, black people and men. Now imagine 17.9 million. So mostly all these deaths are from Africa. And another overwhelming figure there is that one out of three people, 1 out of 3 of these deaths are below the age of 70 years. I believe most people I'm talking to right now, 98% of people that are watching this video, they are less than 70 years. So in ITU forum, I'm almost talking to everybody. In fact, everybody is involved in this particular disease. Because I'm going to tell you the risk factors of these diseases. And I believe you me, 78% of us are not even out of one of these risk factors. Now, CVD is ripping our society. Just imagine last week we lost almost the one I'm aware of in our forum alone. We lost like 3 people. One collapsed and died. The other one had stroke. The other one, I couldn't really figure out what happened. It's a very serious problem. And this topic is not just to, is not to take away the consultation of the doctor or the consultation of the pharmacist. This is just a primary knowledge for you to know what you are suffering from. If you have any of these diseases, also how to manage these diseases. I'm gonna touch everything. It's a very easy. It's. I'm gonna do it in a very simple way and snappy. I told you before, I don't want to burn your data, so it's gonna be like maybe every 50. It's gonna be like a 15 minutes, rush thing. But I'm gonna hit the main topics that will help us in taking care of ourselves. So the risk factors for these cardiovascular diseases like the heart disease, the stroke, the heart failure, atherosclerosis, and arrhythmia is, according to the research, is physical inactivity, staying in a place for a longer period of time. You come from your office, you go home, you eat, you sleep. Tomorrow you go to office, you don't do any exercise, no physical activity. The heart is warning you. You don't eat very well. Your diet is very poor. You're always on junk food, apple, gari, rice, round the clock, every day. Your heart is warning you. You drink too much alcohol in a harmful way. You don't even eat when you drink. You have parties all the time. Your kidney and your heart is warning you. So many things. You eat too much salt. If you go to the restaurant, madam, this thing, too much salt, your heart is warning you. You go to the restaurant, you eat too much nkwobi. Enyegi nkwobi ta, enyegi azụ itakpo everything, enyegi chicken itakpo. Too much oil, fat, cholesterol, your heart is warning you. You have to put all these things in consideration. These are the risk factors of cardiac diseases. We'll come to that. Tomorrow we're going to talk about these diseases one after the other, what to avoid, and how to manage them if you have any. Thank you very much. I still remain my humble self, Jameson Ihuefo, and I will see you tomorrow. Thank you very much.